well, I'm Kenneth Connell, and I am an internist and Deputy Dean in the Faculty of Medical Sciences at the Cave Hill campus. And I'm here at the Zika Symposium. So Zika, it's a big topic in the Caribbean, and of course the university is aiming to address this. My curiosity, even as a specialist in hypertension and attending a Zika virus symposium, really has to do as a patient. So 2 weeks ago, I was driving to my office on campus and started experiencing some joint pains. Didn't think much of it. Then within a few hours, because I'd recently read up on Zika virus and the symptoms, started experiencing most of the symptoms. So the specific symptoms will include the usual things which most people have. I mean, I had them. A very high fever. I was driving in an air-conditioned Jeep and was sweating. And just thought that maybe I just need to adjust the AC. Actually, I thought my AC unit needed servicing. Then as I continued to drive, my fingers were so sore I felt like I would let go of the steering handle, and I continued driving for about 15 minutes, reached the office, and the security guard on entering the office said to me, "You don't look very well." And I thought, that's strange. He said, "Your eyes are red." And of course, Zika virus presents with painless red eyes, so I would not have been aware that my eyes were even red. And when I checked it, they were very red, in fact. But I continued thinking, well, maybe I'm just tired. I have to say, maybe retrospect, that probably about the day before, I had anorexia, which is loss of appetite. And that's not usual for me, so I knew something was coming on. And then, say within 2 hours of leaving the university building, when I decided, well, finally, this is enough, I was covered in a rash, which is called a viral exanthem. But this rash from head to toe, it wasn't itching or anything, but it was obvious. And I guess I felt worse, and the fever continued. I took the usual over-the-counter medication. So I took my own doctor's advice and avoided any NSAIDs or aspirin-type drugs, and I just took ordinary Panadols. And within a few hours, certainly by the next morning, the rash was gone. I had a mild headache, and the joint pains were there, but not as severe as the day before. And the eyes had completely cleared. And I think that's the first thing to go, actually. The eyes clear up, the rash then goes, the fever, headache, usual viral symptoms linger around. And I think if I wanted to be more precise, probably linger around for about another day or so. The last thing to return, which is usually the last thing, was the appetite. The thing about mosquito-borne illnesses is that the disease spectrum is really unpredictable. So most people may have, as has been reported, absolutely no symptoms, where some people, and I have to say that many of my colleagues within the university have had quite severe symptoms. But so you get a whole spectrum of symptoms, and you're always worried, well, how severe is my spectrum going to be? Am I going to be very ill? Luckily, within 24 hours or 24 to 48 hours, I was back to normal. And so I was able to continue work. But I thought, for instance, well, first of all, how many people around me at work might be similarly affected and not know it, and of course transmission, and also how many people in my neighborhood at home, which I have to admit does have a mosquito problem at times, how many of them might be affected. And so today's symposium really was quite useful in that it not only came from the public health perspective, looking at public health measures to reduce the mosquito-borne illness, but more practically, I think, for clinicians like myself to have a heightened awareness, so that when patients do present to our office with a fever or joint pains, that we just don't, for instance, say, "Oh, you're probably coming down with the flu." And as I suggested, that we have some protocol in place to kind of follow up those patients.